Hello everyone, this is Michael Haynes, author of the website HeaR from Haynes. This video is the first part in my crash course training series on health insurance. Part 1 of this series is designed as a quick overview of how health insurance works in the United States. Note that this video simplifies the insurance system for learning purposes. There are some complications not included, but you'll still get a solid understanding of how the system generally works. The U.S. health insurance system revolves around groups of people paying money to an insurer, and the insurer uses that money to cover some of the healthcare costs for the people in that group. I'll illustrate this concept with the idea of an insurance pool. Throughout the year, group members pay premiums, or a general insurance fee, into a pool. That pool of money, called an insurance plan, is typically administered by an insurance company and is used to pay doctors, hospitals, and other service providers whenever a group member receives health care. Many insurance companies have networks of doctors and other service providers that the group members must use in order to be covered by the plan. For example, the Blue Cross Blue Shield network is a national association of doctors and hospitals that certain insurance plans use to provide health care to their group members. The insurance companies negotiate with these service providers to reduce fees for the group. The group's insurance policy determines how much money is used from the pool on each type of healthcare service. The amount of coverage directly affects the premium amount. Plans that cover more costs generally have higher premiums. In other words, the more you want the pool to pay for, the more you have to pay in the pool to keep it full. Most health insurance plans also have some type of deductible, which is the amount a member must pay each year before the insurance plan helps pay for the services. Higher deductibles can also be used to balance higher coverage. The most common insurance group is the type that involves an employer and its employees. In fact, about half of Americans get their health insurance from employers. The employees are all part of the same group and they pay their insurance premiums to the same insurance company. In most cases, the employer also pays part of its employees' premiums as a benefit to them. Employers can offer more than one kind of insurance plan with different coverage levels and member costs. Note that even when you buy insurance as an individual, your insurance company still assigns you to a group to spread the risk. Insurers essentially manage giant groups of individual insurance buyers. You can become a member of a group only at certain times, which are called enrollment periods. The main enrollment period is called open enrollment, and it typically occurs during the last few months of the insurance's plan year. During open enrollment, anyone eligible to enroll in the insurance plan can sign up to be a group member for the upcoming plan year. But once open enrollment ends, the only way to become a group member for that year is to fit into a special enrollment period. Now, special enrollment periods typically involve some sort of major life event, like a job change or a new marriage or childbirth. If you don't enroll during open enrollment, or you don't fit into a special enrollment, then you'll have to wait for the next year in order to be covered by that group's health insurance plan. These restrictions also apply to nearly all individual insurance plans. There's an annual open enrollment period that runs from November to January each year. Now, why do we have strict enrollment periods? Imagine if people could purchase health insurance only when they got sick. Let's take an insurance plan that costs $300 a month in premiums and covers half of the cost of, let's say, a hospital visit that costs $2,000. The sick person would have to pay the first premium of $300 before they would immediately get $1,000, remember half of that $2,000 hospital visit, from the insurance plan to cover that hospital cost. There's no way the insurance company would have enough money to cover group members in need of health care if they only bought insurance when they got sick. Now, the insurance plan would have to either cover less or members would have to pay much higher premiums. But if we limit enrollment, we create some predictability and stability in the plan to ensure that everyone can have adequate coverage. Everyone pays equally from the start, ensuring that there is always money in the pool whenever a group member needs it. Now, one argument against this type of healthcare system is that healthy people have to pay the same as the sick, but they get less physical benefit because they use it less. But the big picture benefit is that the insurance plan will have enough money to support all group members equally if and when they need it. Under the current health insurance system, it is much better to have health insurance and not need it than to need it and not have it. But why isn't health insurance so important? The main purpose of health insurance is to reduce the overall cost of healthcare that you have to pay out of your pocket. All health insurance plans have a limit on the amount of money that a covered member has to pay for healthcare services in a given year. This is called the out-of-pocket maximum, and there's a cap to this amount set by federal law each year. For 2016, that amount is $6,850 per person. Even the worst insurance plan has to have this out-of-pocket maximum. This means that if you have a plan with the least amount of coverage possible, aside from your premiums, you would only have to pay about $7,000 a year on healthcare. Now, $7,000 may seem like a lot of money to a healthy person that rarely gets sick, but consider this. The average 3-day hospital stay in the US costs almost $30,000. If you were individually covered by the worst plan in the country, you'd still only have to pay the first $7,000 of the bill, and even less if you already paid for some healthcare services that year. The rest would be covered by the insurance plan. When you have health insurance, you are insuring yourself from a catastrophic financial hit if something unexpected and unfortunate were to happen. You know what the financial worst case scenario is before it can happen, and you can plan for it. Note that the out-of-pocket maximum amount is for each person covered by the plan in your family. If you have 2 people in your household covered by the same plan, then the out-of-pocket maximum will likely be twice as much, but it depends on your particular plan. Better insurance plans cover more services, but they also have higher premiums. I will discuss how to select and compare insurance plans in a different training video, but the objective is to balance adequate healthcare coverage with out-of-pocket costs that you can afford. The Affordable Care Act is a massive set of federal laws and regulations that significantly changed how health insurance works in the United States. There are many facets to the ACA, but I want to just highlight 5 components of the law that are relevant to this discussion. First, basic physicals, laboratory work, OBGYN, and other preventive care services have to be fully covered with no cost to you. So as long as you're covered by some sort of health insurance in the United States, you have free physicals and routine checkups, as well as a few other preventive services. Number 2, you can't be denied because of pre-existing conditions. Before the Affordable Care Act, if you had a pre-existing condition, meaning a medical issue like diabetes, cancer, even chronic back pain or pregnancy before you enrolled in an insurance plan, the insurance company could deny you coverage, or they could charge you more for it. The Affordable Care Act outlaws this kind of discrimination. Thirdly, the Affordable Care Act requires insurance plans to cover mental health services like therapy or hospitalization the same as medical services. Now, before the ACA, many insurance plans didn't cover mental health services at all, or they covered significantly less of the costs for mental health care. Now, mental health and medical care must be covered equally. Now, to help people with lower incomes afford basic health insurance, the ACA enacted several subsidy programs that either lower the cost of health insurance premiums or provide a tax credit at the end of the year. Finally, the Affordable Care Act made it easier for individuals to find an insurance plan that works for them. Healthcare.gov hosts a marketplace for insurance companies to offer plans directly to consumers and allows people to compare plans quickly and easily before purchasing them during the annual enrollment period that starts in November. The law also restricts insurance company profits and requires companies to refund members if they spend too much money on non-medical costs. Thank you for joining me in this crash course on the U.S. health insurance system. For more information, check out these resources. Now, part 2 of this series will dive deep into insurance plans and how to understand a plan's benefits and coverage. You can see more trainings like this one and read professional insight about employment law, human resources, and talent development at the HeaR from Haynes website at hrfromhaynes.com.